Hello, my name's John. This is Blair. We work with Zoom Physical Therapy. We're located in Victoria, Texas. And we're going to talk to you today about lateral epicondylitis. It's also known as tennis elbow. It kind of got its name from racket sports where you play tennis or racquetball, and the lateral epicondyle is actually the lower end of the humerus, or the big bone here in the upper arm. Well, that tendon that gets inflamed or breaks down connects, and it's actually the one that actually extends your wrist. You have several different muscles that come in and they form what's called the common extensor tendon, and that's what breaks down. And when it breaks down, it gets inflamed, it hurts. You can't even pick up your car keys or turn a doorknob. Some of the common people that get this, the 30 to 50-year-old age range is the most common. Obviously, if you're playing sports such as tennis, racquetball, pickleball, and then your repetitive occupations, hairdressers that are having to use you're using those extensor muscles all day long, office managers that do a lot of typing, painters, carpenters if you're using a hammer. You know, there's a lot of different things that are repetitive nowadays, even if you're working on an assembly line and you're having to do something where you're screwing in something all day long. That starts to break down that extensor tendon, and with what we're going to do today is show you different ways that you can kind of help yourself. Some of the first things that we do is we'll use a heating pad for 10 or 15 minutes. We also use a big stem unit, but most people don't have those at home. So what I'm going to do is show you how to warm that tendon up. We use Biotone or Free Up, and we take just a little bit, and here on Blair I've already marked where the lateral epicondyle is. The common extensor tendon comes in here, and what we want to do is called a cross friction massage, because the fibers are running this way. So if we're going to cross friction, we're going to go in there and find that extensor tendon, and we're just going to go in and actually do cross friction massage. We also go parallel to the fibers. So when we go parallel, we're doing something as when we go down here into the muscle bellies, where we kind of separate those out, because you're going to have pain that radiates. Believe me, if you've had this or have it right now, that's probably why you're watching the video. You have pain that kind of radiates down into your forearm. So we actually go through this whole area, but here at the tendon where it originates, we actually do a lot of cross friction massage. And that's something that you can do on your own. If you don't have anybody to help you, you can get in there with these two fingers and just work it. Obviously in the acute phase, you're gonna have a lot of pain. So just do it to tolerance. Don't hurt yourself, just do it to tolerance. We also use tools. Some different tools that we use. These are stainless steel tools. They come in a set of 5 or 6, depending on which one you actually buy. We come in here, you find where the lateral epicondyle is, you can feel where the tendon is, and you're just gonna kind of do a raking motion where you're coming down. We do this anywhere from 3 to 5 minutes. This is something that really helps. And what we do is we do this first because this is gonna kind of warm everything up for you at home. Like I said, here in the clinic, we're using the heat and stem, and then we go into our different exercises at home. You can do this to warm up as well. Obviously after this, we go into some different exercises. I'm going to show you the 3 main exercises that we do. Your extensor tendons, obviously they extend the wrist. You also have a supinator muscle that attaches here at the lateral epicondyle. It has a couple of other originations here in the elbow, but the main thing that does is it kind of drapes over and it helps you supinate. So what we want to do is we want to stretch those different muscle groups. First one we do though is we're going to kind of do a stretch where we warm it up. What I do is we take you into kind of a 90-degree angle. Obviously if you're having shoulder pathology, you don't have to raise it up that high, you can bring it down, but what I want you to do is come out and then flex the wrist, okay? Do 3 sets of 10 of these. This is kind of almost like a warm-up, but it's also providing a little bit of stretch, so you're coming out and down, okay? 3 sets of 10. Okay, the next one we're just going to do, it's called an isometric contraction of the muscle. The latest research shows that if you do some eccentric muscle contractions for strengthening, it actually helps. So eccentric means that we're going to put that extensor muscle group on stretch, but we're also going to work it where we actually have to. So what we want to do is we're going to have Blair bring her wrist down. She's going to put her other hand here, and what she's going to do is resist this motion, okay? So she's resisting this motion with her other hand. Just 10 of these, but you got to hold it for 10 seconds, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Obviously that's faster than 10 seconds, but you get the drift of what I'm talking about. The next thing what we want to do is, and we want to go to the third exercise, is going to be a stretch. We actually go into wrist flexion, and we're going to, obviously if the supinator does this, well then when we're going into pronation, we're stretching that muscle as well. So we're getting 2 for 1 here. So you're going to also deviate a little bit towards your pinky side. And what that's going to do is that you're going to feel that stretch. Believe me, you'll feel it. If you have the epicondylitis, you're going to feel that stretch. What you want to do is you want to hold it for 30 seconds. 30 seconds is a time frame where it shows it actually does some good, and you can do anywhere from 3 to 5 repetitions of that. After that, we go into what we call an ice massage to kind of help with the inflammation, the pain, the swelling that occurs there. What we do is we take a cup. We don't have one here, but you're going to take a styrofoam cup, freeze it in your freezer, and then you peel that cup back, and we go right where this pink dot is. We just go over that anywhere from 4, 5, 6 minutes. You're going to feel it's going to be cold, and it's going to burn, then it's going to sting, and then it's actually going to turn numb. We do that here in the clinic. Obviously you can just use a cold pack at home to kind of help yourself. Leave that on for 10 or 15 minutes. You want to put a barrier in between that cold pack so you don't actually freeze your skin. We wet pillowcases, slip the cold pack in that, and it really helps. It provides a barrier, but it also gets good, the cold actually really, it gets cold whenever we put that on people. So, and then we also use the ice massage. Other things that we use in physical therapy, we use a cold laser. What that does is it helps the collagen within the tendon actually form a matrix where it heals properly. Usually what's happening within that tendon itself, it's healing, but when it heals, it's healing in almost kind of like a spider web or a cobweb formation. And that makes it really easy for it to just break apart. Anytime you pick up your hammer or you go to typing, then you get that pain. Well, all that scar tissue doing is just breaking apart because it's very weak. It can't hold the load or the force that's actually being applied through the tendon like it would if it was healing properly. The cold laser, there's little research on it, but it does show that it helps that healing process. So we utilize it. We also use ultrasound. Like I said before, we use heat and we use stem. We also do joint mobilizations to the radius where it comes in there and connects to the humerus. The lateral epicondyle is here. If you go down just a little bit, you're going to find the radial head. You also have a radial tuberosity, and that's kind of more the bony prominence that you're really going to feel. The radial head is just up to it from the lateral epicondyle. So how we check to see which way that it probably is sitting, which is causing some of the problems that you're having, is I'll have you, Blair, bend your elbow just a little bit. She's going to squeeze my right hand while I push forward. If she has a lot of pain, then I know that radial head is probably sitting anterior or in this position kind of upward. If she doesn't have pain, then I just relax the wrist. Then I'm going to move my thumb here, and I'm actually going to push down on the radial head. She's going to squeeze. She's having pain with that. So really what that means is that radial head might be, it may have slid posterior or down just a little bit. So what we do is we do mobs where we come in here and we actually take that and we mobilize it. This is something that you can also do on your own, where you take your 2 fingers, you can find your radius, and you can actually go through and bring it in the direction that it feels good. Because you're gonna know which way it sits, because it's gonna hurt a lot more that way. So if it's sitting posterior or backwards, what you're gonna wanna do is try to help move it forward. Now, some of the other methods that we use a taping method. Obviously, you can use any kind of tape. We use Stark tape, but there's physio tape, kinesio tape, kinetic tape, KT tape. There's a bunch of different ones out there. I already have some that are pre-cut. What we do is we're going to peel this back part off. So Blair's going to kind of hold her arm up like so, and because I want to keep it bent just a little bit. This is the spot where I want to go over. So when we take the tape, we tear it here in the middle. Okay, we don't want to get our hands all over the tape because it won't stick as well. So what we do is we're gonna bend the paper part back. We're gonna apply, that's 100% stretch. So what we want to do is we want to back off just a little bit from that. Go anywhere from 50 to 60% stretch. and then we're gonna lay it down on the ends. These ends just lay down, the stretch is here, okay? Then we're gonna smooth that out. And when we smooth that out, what that does is it heats up the tape so it sticks better. Now we take our second piece of tape. This one we're not gonna tear in the middle, we're gonna tear here on the end because we wanna anchor this right here just above the lateral epicondyle. And we're gonna come down through the extensor muscle group because this is gonna take some of the force off of these muscles, which is gonna, in turn, it's not gonna have as much tensile force at the lateral epicondyle. So it's gonna feel better. So what we do is we're gonna tear the end here, and then we come here, we're just gonna lay this down just above that tape. Okay, now we're anchored down so we can grab this piece. We're gonna kind of come down, and then I'm gonna have Blair bring her wrist down into flexion. Okay, so now we're gonna go 100%. We're gonna back off just a little bit because I want it to be 80% through about 75% of the tape. And then you just lay down the rest. You don't wanna really go over the wrist because you're probably gonna have some, it's gonna have some give there. There is a method that you can use that goes all the way down and it hooks here. You actually cut some notches here in the tape and it hooks here. That's a really good taping method as well because you do have the tendons that come all the way down here. I may make a video that shows all that. You want to heat this up really good. I do this for about 1 to 2 minutes to get everything to adhere down properly because this is going to last anywhere from 1 to 3 days depending on when you come back for therapy. Now, this is what we usually do with the physical therapy here at Zoom. Obviously, we have a couple other methods that we talked about if you're really needing the physical therapy to come in. Other than that, if you have any comments, please leave them. If you want to see some other things in regards to different videos, also leave those in the comment box. Otherwise, please subscribe to our channel and give us a like. Other than that, we'll see you next time. Thanks for watching.